Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Antithyroid drugs, and we're looking at its classification. So first we'll start off with the diagram. So first let's look at the lysosome. Let's start from the lysosome. So assuming this is the lysosome. So this gives rise to, there is Tg, that's the thyroglobulin. Next from here there is T3 and T4. So they can be secretion here. So they can be secreted. And the iodides, it acts here. So other thing to note is that there is a radioactive iodine. So this enters and it destroys the thyroid tissue. So this T3, it comes out. So after the T3 comes out, there's a T3 and the T4. So they can undergo deiodination and form the T3. So there is deiodination. So then here what stops this? This is inhibited by the propylthiouracil. So it is prevented by the PTO. Now moving on to the T3, we started with T3, T4. So on the other hand, there is MIT as well as TIT. That is the monoiodotyrosine and the di. So this acts upon the deiodination and it forms the iodine. And looking on the surface, the backstory, the iodine, it enters. So this is nothing but the NIS. So it enters and then there is trapping, which is seen. So trapping, this is inhibited by certain things such as the thiocyanide, the percolates as well as the nitrates. So we'll see in detail classification later. So this iodine, it comes out as and then there is an exit through the pendrins. This is pendrin. So here the iodine, it comes out and this there's from I minus to I plus. Next is the Tg attached to the MIT and the DIT. Then they form coupling. This is known as coupling and it gives rise to Tg, that is DIT, MIT, T3 as well as T4. And later on what happens is they undergo endocytosis. So upon endocytosis there is formation of Tg. So this Tg, it enters into the lysosome. So this was a rough representation of what is happening. So this main structure we saw was nothing but the follicle and the outside it was nothing but the periphery. Now let's look at the use of thyroperoxidase. So there is something known as the TP, that is thyroperoxidase, that is H2O2. This is thyroperoxidase. So what is inhibiting this thyroperoxidase? The answer here is the propylthiouracil. So this propylthiouracil, there is carbimazole as well as the methimazole. Now this was all about the pictorial representation. Now let's look into the theory. So firstly, let's look at the drugs which inhibit the iodine trapping. So what are the drugs which inhibit the iodine trapping? This is by the thiocyanates as well as the percolates, and there is also the presence of nitrates. Next, let's move on to the drugs inhibiting the hormone synthesis. So what are the drugs which inhibit the hormone synthesis? So this is nothing but the propylthiouracil. We are writing it as PTO, methimazole, as well as a carbimazole. Then we move on to the drugs which inhibit the hormone release. Inhibit the hormone release. So this includes the presence of iodine. So there is iodine, there is sodium iodide, there is potassium iodide, as well as the organic iodide. Next we look at the drugs which inhibit the peripheral conversion. So the drugs which inhibit the peripheral conversion. So this will include the propylthiouracil, the amiodarone. Next is the iodinated contrast dyes, that is the ipanoic acid. Then there is propranolol as well, propranolol, and there is a glucocorticoids. Next is the drugs that destroy the thyroid tissue. So drugs which destroy, so it destroys the thyroid tissue. So this is nothing but the radioactive iodine. So this is the radioactive iodine. To learn and grow daily like this, please do subscribe.